Well, this is just disturbing to hear. Dr. Anthony Fauci, a key member, you might even say the leader of the White House coronavirus task force on many days, he is now facing death threats.
We couldn't believe it when we learned about this. He's been forced to beef up his security detail following growing concerns for his safety. Our senior justice correspondent, Evan Perez, broke the story and joins us now. How can this be?
Well, that's one of the things that happens with the increased profile that Dr. Fauci has now taken. As you mentioned, he is essentially the face of the government's response to this pandemic. And it appears that as a result of that, he's gotten an increased number of threats. And so the Health and Human Services Department essentially decided that he needed to have more personal protection. They reached out, the Inspector General for HHS reached out to the Marshal Service, which essentially deputized some officers from the Inspector General at HHS who are now acting as Dr. Fauci's personal security. We also know that the Metropolitan Police here in Washington has also increased the amount of protection around Dr. Fauci's home. But again, guys, it is one of those sad testaments to the increased profile that Dr. Fauci has taken during this crisis, that he's getting these threats now.
Gosh. Oh, I can't believe it. Evan, thank you for that reporting. Of course, we're wishing him all the best. He is doing so much for this country right now. Also, more than 30,000 Americans are back at home after being stranded overseas because of travel restrictions, of course, prompted by the response, Jim, to this outbreak.
But they're not all home. Thousands more still need help getting back to the United States. CNN national security correspondent Kylie Atwood joins us now from the State Department. How many still out there, and how are they going to get back?
Yeah, well, Jim, the State Department told us yesterday that they are still tracking about 24,000 Americans who may be seeking assistance from the U.S. government to get back to the United States. And to give you a little bit of context here, these are largely American travelers who were in countries that then closed down their borders, closed down their international airspaces, preventing them from getting home. And the State Department has already helped 30,000 of these Americans get home. But the message from the senior State Department official who is leading this repatriation effort yesterday was pretty blunt. He told Americans, listen, when an earthquake happens, you don't stand on lower ground and wait for the tsunami to come. You seek higher ground. And he said in this instance, the earthquake has already happened. So these Americans who are abroad really need to be seeking assistance to get home now. And he said that that assistance that's being provided at this time by the U.S. government may not be available in a few weeks' time. So it was a very clear call to these Americans to seek assistance now, because they really should be getting back to the United States with their families to help the U.S. fight this coronavirus and keep it contained.
Kylie Atwood, thank you so much. I'm thinking about all those folks still waiting to get back here.
Dr. Anthony Fauci is the country's top infectious disease doctor. He's the head of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. As you know by now, he's a member of the White House Coronavirus Task Force. Dr. Fauci, thank you so much for joining us. I know you got a lot going on, but I want to start with the story Manuel just did about the passengers on the ship. On one hand, you have passengers who are sick, who need attention right away. On the other, you have so many who are not sick, who are very frightened. What are your thoughts? Should they be let off the boat?
Oh, absolutely. There are a couple of things that need to be done, and we have experience, remember, with the Diamond Princess in Japan a short while ago. First of all, you have to take care of the people who are ill. You just have an obligation to do that. And as quickly as possible, you've got to get the people who are not sick, who are not infected, off the ship. Now remember, there are both Americans and people from other countries. So we've got to get the Americans off, and we've got to get the people from the other countries safely back to their own country in cooperation with the responsible country. But this is absolutely necessary to do before you get further spread of the infection.
It does seem to be a humanitarian issue. And I want to say to the audience, there's a slight delay with Dr. Fauci, but we can hear each other. So bear with us. Dr. Fauci, we all know this is a pandemic of numbers. And I heard you say the other day, the now projections are up to 240,000 people could die. And this is practicing the social distancing. I also heard you say we should not be discouraged. I was encouraged to hear that. But why should we not be discouraged when we hear such frightening numbers?
Because it's within our power to modify those numbers. those numbers that you heard the other day that Dr. Birx and I mentioned from the White House press conference were numbers based on a model. You model what the projection might be. And the projection was that even with considerable mitigation, you still could anticipate between 100,000 and 200,000 deaths. However, if you really push hard on mitigation and data comes in that tells you you're doing better than the model, you can modify the model. So what I was saying is, though, even though we need to anticipate these rather disturbing numbers, we shouldn't give up and accept it and say, okay, that's going to happen. We need to push and push with the mitigation to try and get that number lower than the projected number by the model.
So it doesn't have to be inevitable, is what you're saying. You know, the CDC says 25% of the people don't get symptoms of coronavirus. So how will we know when it's safe to lift the restrictions?
Well, there are a couple of parameters that you look at. One is you look at the curve of the new infections, of the people who get hospitalized, and the deaths. Those graphs that we have been showing at the White House, the one that peaks and then starts coming down. But also we're going to be instituting tests that can actually show how many people in the population have been infected. So in addition, right now we're focusing on those who have symptoms, getting them identified, isolated, trying to get contact tracing, doing physical separation. But what we would like to do reasonably soon is to get a better feel for the totality of the infection in the community, even those who've recovered. And you could do that by a relatively simple antibody test. That's one of the things that we're aiming for as soon as possible.
President Trump says he's considering banning domestic travel. Is that your advice to him?
No, we look at that literally every day. It really depends on what city you're talking about and from where you are coming. So this is something that you're absolutely correct is on the table and it's discussed, but no decisions have been made about banning travel within the domestic United States.
Dr. Fauci, I know we have to go, but there are reports that you now have to have security. I was very sorry to hear that for you. And I'm wondering the personal pressure. Do you feel pressure to get this right? You know, you are the most respected, the most admired. When you speak, we listen. I'm wondering how this has affected you personally.
You know, it's my job. This is the life I've chosen, and I'm doing it. I mean, obviously, there's a lot of pressure. I mean, I would be foolish to deny that, but that's what I do. I've been through crises like this before, dating back, 37 years from the very beginning of the HIV epidemic. It's a job to do, and we've just got to do it.
Well, Dr. Fauci, listen, you're on donuts, you're on socks, you're on mugs. There's Fauci Friday, People Magazine. There's a petition to make you sexiest man alive because people say brains are sexy. So we are all paying attention to what you're saying. I'm wondering how what your family thinks about all of this.
It's really kind of crazy. We try not to pay attention to that and just focus on the responsibility and the job that we have. That's the most important thing, not that other stuff.
It is the most important thing, and we are all cheering you on. Thank you, Dr. Fauci.
Good to be with you. Thank you.
And joining us now, also on the front lines, Dr. Anthony Fauci, a key member of the White House's task force and the director of the National Institute of Allergy and Infectious Diseases. Doctor, good morning. It's good to see you again. Appreciate you being with us.
Good to be with you.
Let me ask you about what Vice President Pence said yesterday. He said the U.S. trajectory right now most closely resembles Italy. That is not great news. Italy right now represents more than a quarter, almost 30% of all global deaths from COVID-19. Can you explain why the U.S. looks like it's on the same path as Italy right now?
Yeah. It's just the reality, Savannah. I mean, it's the truth. If you look at the curves of the acceleration of cases, hospitalizations, and deaths, it's superimposed, corrected for population. It's a really serious issue. I mean, Italy got hit very hard, and it's very clear that we are getting hit very hard. Right now, the epicenter of it in the United States is New York City. But as you see, it's not going to be confined to New York City. We're going to be seeing this kind of thing in other large cities. It's a very difficult situation, as was predicted. This is going to get worse before it gets better, for sure.
The Surgeon General was on with us just yesterday and said, my advice is that the 30-day guidelines to stay home from the federal government amount to a national stay-at-home order. Is that how you see it too? Do you agree?
Well, yeah, I mean, if you look at what's in those 30-day recommendations of the guidelines, that's essentially what it is. I mean, I know it's difficult, but we're having a lot of suffering, a lot of death. This is inconvenient from an economic and a personal standpoint, but we just have to do it. That is our major weapon against this virus right now. Yeah. We don't have a vaccine that's deployable. This is the only thing we have. And we can get through it if everybody really leans forward and pushes on this.
Can I ask you about that? You know, more states yesterday started having these stay-at-home orders, but not all states do. And even the states that do, some have exemptions. Florida exempts religious services in some cases. I saw New Hampshire had exempted florists at one point. Arizona had exempted hair salons at some point. I mean, with all due deference to states, shouldn't there be a national order, a national lockdown, a requirement, rather than this hodgepodge piecemeal method?
You know, you have a point there, Savannah, but it's one of those things that in our country there still is that issue of central government versus the ability and the right of a state to make their own decision. But again, I agree with you. When you see things like some of those exemptions, I mean, I can't make any official proclamations here, but I can say really seriously consider, are those exemptions appropriate when you think about what's going on? And I urge the people at the leadership at the state level to really take a close look at those kinds of decisions.
Doctor, we're all getting a little bit of a medical education, unfortunately, in these times. And you said on an interview the other day that there was something mysterious, that was my word, not yours, about the pathogenesis of this disease. That was your word, pathogenesis. You said that some people have mild and even no symptoms, and then others who aren't necessarily old with underlying illness get really, really sick, and we just don't know why. Are we any closer to figuring that out?
No, that's going to require what we call natural history studies. I mean, I have been puzzled from the beginning. I mean, that sharp dichotomy that said, you know, if you're older or if you have an underlying condition, you get into trouble. If you're younger, the likelihood of that is still very low, which it is. But it is very strange how one individual can get infected and have either mild or no symptoms, and another individual could rapidly deteriorate with viral pneumonia and respiratory failure. There's something in mechanism, whether it's genetic, whether it's immune response. The one thing I can say that we have to be humble. I've been doing infectious diseases now for almost 50 years. And I could tell you, I don't fully understand exactly what the mechanism that is, and we really need to figure it out. Because it can be completely devastating rapidly in one person and absolutely nothing in another person.
I know our best brains are on it. There's a new study in the journal Nature that showed patients with mild symptoms, can shed high levels of the virus early on during the first week of infection. I don't have to tell you how disturbing that is. Do you credit that study?
Yeah, I mean, that's the truth. I mean, we're seeing a lot of things now that are falling into place. Remember, weeks ago when I interviewed with you, I said we know a lot, but there's still a lot that we don't know. I mean, the idea of someone who's asymptomatic shedding high titers of virus is very disturbing, because that person could be out there feeling well and inadvertently and innocently spreading the infection.
Dr. Fauci, it's horrendous to even have to ask you about this, but there's a report in the Washington Post that suggests there have been threats against you, some from admirers, well, some threats, and then some disturbing interest from admirers, but whatever it is that you've had to increase your security detail. I'm not asking for the details of that, but I will ask you if you yourself feel personally threatened at all. Do you feel safe? Do you feel that your family is safe?
You know, I do, Savannah. I mean, I've chosen this life. I mean, I know what it is. There are things about it that sometimes are disturbing, but you just focus on the job you have to do and just put all that other stuff aside and try as best as possible not to pay attention to it and just forge ahead. We have a really, really very, very difficult situation ahead of us. All of that other stuff is secondary.
Are you okay? Your voice does not sound great. I'm hoping it's just because you've been doing a lot of interviews and briefings and stuff.
No, I am fine. I'm physically fine. But, you know, all I do all day long is brief people, governors, senators, White House, interviews. I just need to keep my mouth shut for a little while. I think it'll get better.
Well, tea with a little honey and lemon for the doctor, okay? Thank you for being with us this morning.
All right.
Our viewers appreciate it.
Good to be with you.
Thank you.